today I want to talk about something kind of scary. You get peed on so much. So I wanted to sit and chat with you guys for a little bit. If you are new to my channel, my name is Lindsay. Hi, welcome. I am a second-year pediatric resident, almost a third-year pediatric resident. So basically what that means is I did 4 years of medical school after I did my undergrad, and then I graduated from medical school. So I'm a physician, and I am now in the end of my second year of my pediatric residency training. So short for kind of all of that mumble jumble is I am almost done with my training to be a pediatrician. So I am in pediatric residency, which basically allows you to work under a bunch of different pediatricians and learn how to be the very best pediatrician that you can be. And then at the end of all of this, you take an exam and you become a board certified pediatrician. So that is where I am in my training. That is a little bit about me. I'm married to my husband, who is also a physician. He is an adult doctor though, not a kid doctor like me. So that's kind of about me. If you are new here, I would love if you would subscribe to this channel down below. And also, I am really active on Instagram, so that's where I tend to post most of my content. My Instagram is The Primary Pediatrician, so I would love if you would go over there, follow me, engage with me over there. It would be wonderful. So that is a little bit about me and kind of what I am, my credentials, who I am, all of that. So that was kind of a lot all at once. But today I want to talk about something kind of scary. I get asked this all the time, over and over again in my Instagram DMs. People are asking me, what is it like to be a pediatrician? And the number one question I get by far is, what is the worst part of being a pediatrician? What don't you like about it? And it's kind of funny because I don't think during my training I really asked anybody that or really kind of thought about it. I was always just like, oh, you know, I love pediatrics. I could do a whole video about why I went into peds. Comment down below if you want me to do a video on why I went into pediatrics. But I was so focused on why I liked pediatrics that I never really thought about what I might not like or what the negatives to pediatrics are. And I think it's a great question, especially all of you pre-meds who are trying to decide if you want to even be a doctor, if you want to do this, if being a pediatrician is your end goal to begin with. So today I just kind of wanted to talk about what the worst part of being a pediatrician is. So I think with everything, and me being a scientist in my, science brain, we always have to think about risks versus benefits, right? I actually just had a long conversation with one of my coworkers the other day about the COVID vaccine and how to talk to patients about it. And it's all risks versus benefit. That's how a lot of things in medicine can really come down to. A lot of the treatments and therapies we do have risks, but the benefits outweigh the risks. And so I think that that's kind of the way you have to look at picking a specialty too, right? Every specialty has its risks or its negatives, kind of more in the context of choosing a specialty. There's going to be negatives to every specialty, right? And a lot of specialties have the same negatives because a lot of it are just things that are ingrained into medicine and we have to deal with it whether we're in pediatrics or internal medicine like my husband, if we're in surgery, wherever we are, we still have to deal with kind of these nuances and things that aren't perfect about medicine. However, a lot of different specialties have different negatives as well. So I think that You have to really look at the positives of the field that you want to go into and the things that make you smile and the things that draw you into the field, and then see, do these negatives outweigh the positives? And for me, 100,000 times over, the negatives of pediatrics are very minimal in my mind, and the positives outweigh the negatives 100 times over. I would absolutely choose to be a pediatrician again and again and again, and I think it's the best job in the whole world. But I'm biased, so I want to give you some actual things that I thought about, and I put together a little list of what I don't like about being a pediatrician. All right, so the first thing that I don't like about being a pediatrician, there is a lot of paperwork. So in any medical specialty, there's a ton of paperwork. My husband and I always talk about how much stuff we have to do at the hospital, how many things we have to do for admissions and discharges, and there's just a lot of paperwork in general for medicine. The good thing is, in medical school, we spend a lot of time in adult medicine. So I do have something to compare it to, because I feel like I had a pretty good exposure in medical school. So for pediatrics, with the paperwork, a lot of the times kids are generally healthy, right? Kids just have less medical problems than adults. It's just kind of a fact. Most kids are generally healthy. These are all generalizations, so obviously there are exceptions to this, but just kind of in general, kids are healthier than adults. They have less medical problems. So usually when they get admitted to the hospital, it's for one reason. So either they have like an orbital cellulitis, an infection of the skin around their eye, or they have pyelonephritis, an infection of their urinary tract up into their kidneys. Generally, they're admitted to the hospital for one reason. And then once we can get them on an antibiotic or get them on the medicine they need to be on, generally for kind of a basic illness, then they can go home. So the thing with pediatrics is we have a really fast turnover rate of patients in the hospital. Generally, they'll get admitted one day, overnight, get on antibiotics, and they'll go home the next day. Now, this is not talking about the PICU, the pediatric ICU, where patients are much more complex. We have a whole complex care service that is much different, and kids stay in the hospital for much longer too. But just kind of in general, patients' hospital courses tend to be very quick, and there's a fast turnover rate. What this means is that there's a lot of paperwork for admissions to the hospital and discharges, and you're doing it really fast. So you're admitting one patient one day and you're discharging them the next day, and you're doing all the paperwork for the admission, all of the paperwork for the discharge. So it just tends to be a lot all at once. And I think that tends to be a drawback of any specialty, but just something I've noticed with the timing of pediatrics and the paperwork with the fast turnover of hospitalizations. So now, the next part of pediatrics is the part that is really tough. And a lot of people say this to me: how do you deal with the hard cases? How can you go into pediatrics? I just feel like I have too big of a heart. I couldn't handle the hard cases. People say that to me, and I kind of think that it's a little bit funny, because telling a pediatrician that they have too big of a heart, they couldn't go into peds, is kind of just ironic, because most of the people who go into peds have a really big heart for kids. That's why we do this. So it's just kind of a funny thing that people say. But the thing that is really hard about peds, and sometimes weighs on you a little bit more, is the really hard cases. And in peds, there tends to be a lot of tough cases, because generally kids aren't supposed to die. And I know that's kind of morbid to think about, and it's kind of a blunt statement, but generally kids aren't supposed to die. We don't like to see kids die. Nobody does. It's really upsetting, and it's just horrible. And a lot of times in adult medicine, at the end of a patient's life, when all of their family's there and they've lived a wonderful life, it is heartbreaking and tough for the families, and you feel for them, you feel that sorrow and that pain. But I feel like it is a little bit more of a kind of well-rounded story when older patients die. When these young patients die, nobody really handles it well. It's tough on the physicians, it's tough on the nurses, It's so just unbelievably heart-wrenching on the families and the siblings. It's just hard when kids die. And so I think that that's the absolute worst part of pediatrics, and the part that really does tug on your heartstrings, especially because we're drawn into pediatrics because we absolutely love kids and we only want to see them thrive. And that's our whole goal in life, is to keep kids healthy. So it is really, really tough. There's also a lot of sad cases in pediatrics. There's a lot of accidents in pediatrics, and when you have regular healthy children who get into these accidents, it's really, really tough. So I think the hard cases are really the absolute worst part of pediatrics. I would do admission and discharge summaries all day long to not have to see those hard cases. And so I do feel like that is the absolute worst part of pediatrics. Another negative about pediatrics is you get peed on so much. No, I'm just kidding. That's not really a negative, but it's true. You do get peed on a lot, but whatever, it's baby pee, change the diaper, life goes on. So that brings me to the very end of this video, which is why I want to just talk really quickly about the reasons I love pediatrics. These kids are so resilient. They can make it through so many things. And I think that that's something that I really like about pediatrics, is how kids are just survivors and they are resilient. Okay, I needed more coffee. And a negative of pediatrics that some people might say would be dealing with the parents. I hear that a lot. And to me, I would not classify that as a negative. I absolutely love talking to parents. I love counseling them and walking them through some of their most scared moments. That's why I went into pediatrics. I love talking with the parents. So to me, that's not a negative. So I'm not going to include that on my list. One other thing that I don't like to throw in, because I don't feel like it matters when you pick a medical specialty, would be the pay. Pediatrics in general as a specialty does not get paid as much as adult medicine. So a pediatric cardiologist does not get paid as much as an adult cardiologist. A pediatric GI doctor does not get paid as much as an adult GI doctor, et cetera, et cetera. So really, that I think is kind of a negative of pediatrics, just because kids' health is so important, and the preventative things that we can do in childhood can lead to more healthy adults. I wish it was valued that way and we were compensated that way, but I really don't think compensation matters, and I don't even think I would include that as a negative either. But it is just something to think about if you're going into pediatrics. I think that for the most part, kids are generally healthy, and pediatrics tends to be a very happy and rewarding specialty. All right, one more sip of coffee. So if you like this video, I would love if you would give it a thumbs up. Also, go find me on Instagram. My Instagram is The Primary Pediatrician. I would love if you would go over there and check out my Instagram. I make lots of fun reels. I talk about medicine and fashion and professional fashion. So all of that you can find over there. If you have requests for more videos, put them in the comments below. DM me on Instagram. Let me know what you want to see. I would love to make more videos. I love talking to you guys. You guys are so supportive and kind. So I really appreciate all the love I get. And I will see you in my next video. Bye. And with that being said, Ivy, what are you doing? Hi. You're interrupting the video. You're interrupting. Look at your cute sweater. You're so cute. You're so cute. Okay, I've got to finish the video, Ivy.